So we're going to go ahead and start our introductions. And then as we're doing those introductions, if you haven't yet, if you'll go into the chat and please introduce us to who you are by your name, your role, if you're coordinated with a specific county and one area, if you received technical assistance that you found most impactful for your CPP team. And so I think the presentation on the website reflected a little bit of a different name, but we are actually calling this the FFPSA Fiscal Considerations because we see this as much more of an inclusive component where there's a lot of considerations and there's a lot of interpretations that are still being done. My name is Brenda Manus, and I will do my introduction second, but I'm going to actually turn it over to my teammate who will also be co-presenting with me, Jennifer Barnette, to start with her introduction first.
Good afternoon. Thank you all for choosing this session. Hopefully there will be information that you feel that you can take away, or if you have any suggestions for additional information, please feel free to provide that to us as well. As Brenda said, my name is Jennifer Barnette, and I am with ICF. I joined ICF almost 2.5 years ago and work as a child welfare fiscal specialist, working with jurisdictions in developing, supporting, and implementing their Families First prevention services, comprehensive prevention plans. I spent over 27 years working in local government in North Carolina. My first 17 years were spent as a direct social work practitioner, supervisor, and program administrator. And as a program administrator, I became involved with quality assurance for our social work practice. And one aspect of that was ensuring compliance with Title IV-E. And this is where I additionally worked with various child welfare funding streams and the associated eligible activities. After completing graduate school and 17 years in social work, I moved over and worked for about 5 years as a business officer for a consolidated health and human services agency, and had responsibility for budget, finance, and contracts for social services, public health, and some behavioral health functions. I had the responsibility for the administration of various federal, state, grant, and local revenues to support our county's mission, which included Title IV-E. And my last 5 years in local government, I spent as a budget director for the county government. So thank you all. Welcome.
Thank you, Jennifer. So I'll go ahead and do my introduction now as well. So as I'm conducting my introduction, please feel free, if you haven't, to put your information in the chat so that we get to know who each of you are as well. Good afternoon. Thank you again for joining us this afternoon. My name is Brenda Manus, as I stated earlier. I joined ICF over 3 years ago as a child welfare fiscal specialist, who also provides different supports to jurisdictions in their developing, their supporting, or implementing of the Family First prevention services, comprehensive prevention plans, and their pathways. As Jennifer, I'm also responsible for those fiscal components, such as setting up or implementing fiscal processes for being able to maximize funds, braid funds, or look at claiming and sustainability. I have over 30 years of experience in programmatic and fiscal areas, working and collaborating in mainly the social services field, but also in some of the, what I would say, sister or partnering agencies, such as juvenile probation, behavioral health, prevention work, those kind of areas. So I provided direct work to families and children, and that's how I started out my career, is actually working with them directly. I've done work around prevention services, that supervision, leadership, management, training, looking at different areas around Title IV-E, specifically in managing the program in the state that I'm from, as well as part of that managing of that program, looking at the components in relationship to the university 4A programs and bringing individuals into the child welfare workforce. I've looked at and worked on development and implementation of policy and procedures, and looking at overall development, implementation, and management of programs within a child welfare or juvenile probation system. In my work, I also collaborated with many tribes and pueblos, and basically worked closely with those tribes and pueblos, the different sister agencies such as Human Services Department, Adult Protective Services, Behavioral Health, or Juvenile Probation, as well as universities on basically implementing and developing programs, policy development, workforce training in different areas around child welfare in both the intervention side and the prevention side. So if you haven't yet, please feel free to enter your information into the chat. And we look forward to working with you. We will provide opportunities for questions, but utilize chat as you're going along. We'll try to respond to questions as we move through. If there's areas that we don't get to, we will try, if you give us your contact information, we will get you information after the presentation, or we'll try to get to them as we're able to through the presentation. Our slide deck also will help you and guide you in some of the information as well. It's pretty self-explanatory, so that will also assist and support you. So here is our agenda. And so as you see, we've already done the welcome and introductions. We're going to then start talking about some of the current challenges that counties are having around Families First. And what does that look like? And then we're also going to then look at that in relationship to a solution of how do we keep the momentum. We're then going to move into some of the fiscal topics for consideration and what that looks like, and move it into then some discussion around those fiscal areas, and have really kind of go through some scenarios and work through some of these areas. And then we'll really go from there around some next steps that you as a county or you as an individual can do around prevention planning. So these are our objectives that we have here on this slide. And so as you see from both the agenda and the objectives, that we have a lot of information that we're trying to share in an hour time frame. So again, we hope to get through all of this information. If we don't, then a lot of it is self-explanatory through the PowerPoint slide deck, as well as you're welcome to reach out to both Jennifer and I. Our contact information will be at the end of the slide deck, or we can also put it in chat as well. So we're going to basically look at, helping with developing a more of an understanding or a general awareness of the requirements that are needed for Title IV funding. And we're going to really break that down into these 4 areas of maintenance of effort, supplanting versus non-supplanting, payer of last resort, and braiding versus blending of funding. And then we're going to go into what are those allowable activities and what is allowable compared to the state block grant that California has provided counties compared to the federal funds through Title IV of the Family First funds. And then basically moving from there into how you can continue to build that momentum moving forward. So I'm going to turn it over to Jennifer quickly, and she's going to start talking about some of those current challenges that we have.
So we wanted to begin today by acknowledging challenges that you are or may be encountering with your implementation of your prevention plans or pathways. 3 challenges that we're commonly hearing across counties are here. Counties' existing funds are limited and becoming more limited as implementation continues. The child-specific administration and services claiming is unavailable until CARES is live and active. And then it's unknown if CDSS can or will advocate for state general funds beyond fiscal year 28. And so it would be great if you all would be willing to either share in chat, or if you feel comfortable enough and want to raise your hand and share any of the challenges that your county has experienced with these initial phases of implementation. So is there any that anybody's willing to share?
Yeah, this is Frank Andrade with San Diego County Probation. Yeah, some of our concerns, I guess, although we are prepared and we are collecting data to claim towards the block grant, I think everybody's still a little leery to pull that trigger. And I think that, if we can get some more guidance or understanding of how that is going to impact us, I think we would feel a little more confident in pulling that trigger and start that, some of that claiming towards that block grant, try and coop some of the money that's already, going out with all our efforts.
So let me just clarify, Frank, just so that I know, in this, it sounds like it might be one of those for us to add to advocacy, right, with CDSS.
Right.
So the question is about the timing of reimbursement for the 50% share, that's the Title 4E. Am I correct?
Yes, yes.
Okay.
Yep. Yep.
Thank you. I do not have an answer for you today, but I will certainly, we could add that to an advocacy list in kind of, conversations going forward.
Great. Thank you.
Thank you.
And we also had some in the chat as well. Katie references that they have additional challenges in sustainability for funding for concrete supports. And that has been referenced by also Patty with Santa Clara, Bud Seeley, and Felicia as well. And then also planning for sustainability are the areas that are coming up in chat. And then we also have a question from Dennis on were the FFPS funding from the state to the counties provided from ARPA funding?
So the question around ARPA. So has ARPA been provided to the counties? Is the
Right.
question.
So I think the question is in relationship to the FFPSA state block grant, and correct me if I'm wrong in the way I'm interpreting the question, if it is coming from ARPA CB-CAP funds, if we know where it's coming from.
And this is Dennis, and yes, that's the question.
Okay, thank you, Dennis. I think our understanding, and Jennifer, please correct me if I'm wrong, is that the FFPSA state block grant was general funds that California basically allocated for this for the planning and development and implementation for counties to utilize. So my understanding is it's not coming from ARPA CB-CAP, but that is an area that we can further clarify.
My thoughts are, and again, we can go back to verify this, but ARPA CB-CAP's original source would be federal funding sources.
Mm-hmm.
Great questions.
And then Katie has a question on if 4E is generally reimbursed on a quarterly schedule. And then the question, there will be additional delays related to 4A prevention auditing review requirements. And so, yes, it does usually get reimbursed on a quarterly schedule. And the federal partners are doing currently that kind of auditor review, but it's only including part 4 as well as the traditional Title 4E. And so part 1 has not been yet included in that review yet. We expect it will be, but we have not seen the timing of when that will actually occur. And then Wendy has in the chat basically just the timing of when to use and tap into different funding. And so how to do that kind of braiding, or how to decide what funding comes first and what to utilize there. So hopefully we'll answer some of that, Wendy, as we kind of move forward. Okay, so I'm going to move us to the next slide.
So in the context of these challenges, what is it that we can focus on to keep the momentum in our planning and implementation? And some of these strategies may already be incorporated into your prevention plans, and maybe you've determined that your original plan needs to be adjusted considering some of these current challenges. And so the first one is, what opportunities are there to leverage existing prevention activities and initiatives within social services and probation? And so maybe building on something internally can help manage that risk and maybe help, feel better about some of the uncertainty. And then next, maybe, looking at, are there opportunities to combine different funding sources that include behavioral health, schools, public health, and other partners? Because we know that Title 4E is only one fund source, and with the considerable strings and the reimbursement is delayed for services, along with the child-specific administration, collaboration among these partners maybe could help mitigate some of the financial constraints and enhance the overall effectiveness of the initiatives. And then, what are the opportunities to leverage ongoing prevention activities within the community? So what are community-based organizations? What are your family resource centers doing? even faith-based organizations or others, and how are you joining with them, to find out that information. And so within these strategies, we could additionally include pilot programs, right? So testing the small scale initiatives that can be scaled up once more funding or CARES is available. And as we talked about earlier, it's that continued work with CDSS, right? Collaborate closely with CDSS to advocate for additional state general funds and support. And while this information isn't new and was directed as part of your original CPP planning, maybe revisiting some of these strategies will help you maintain momentum in your planning and implementation efforts, even in the face of the financial constraints. So the next slide, please, Brenda. So the strategies we just reviewed are a direct application of community asset mapping, which focuses on utilizing the local strengths and resources and may help determine options to mitigate financial barriers by diversifying funding sources and leveraging collaborative efforts. By understanding the local context and available resources, pilot programs could be designed to address specific community needs and scaled up effectively once more funding becomes available or has been one of the intended uses of the state block grant. And so, stay there. Thanks, Brenda. So most of you are, familiar with the community asset mapping generally in the context of programs, right? Identifying the resources. But asset mapping is a really powerful tool that can significantly aid in the various aspects of not only the program evaluation, but funding compliance. So by continuously updating the asset map, organizations and communities can adapt to changes and maintain relevance. The adaptability ensures long-term program sustainability and ongoing financial support. You all completed these steps or very similar in the creation of your comprehensive prevention plan. And so to refocus and keep the momentum moving forward for your prevention planning, it could be helpful to revisit and update your asset map, inclusive of fiscal assets, right? So when you're meeting as organizations and you're talking about programs and initiatives, it's engaging in the conversation about what funding sources are also being used to support those programs or initiatives. And you may have initially completed this 18 to 24 months ago, but in consideration of current challenges, maybe the plan needs to be amended. The additional benefits of asset mapping is it's really an integral part and establishes the foundation for you all to evaluate your maintenance of effort compliance, to be able to detect duplication and promote use of new funds so that you can ensure that you're not supplanting. It offers the ability to enhance coordination to use new funds or to ensure that you are complying with the payer of last resort. And lastly, it creates awareness and relationships for effective funding use that, future conversation around, how can we braid or blend funds to support programs. And Brenda is going to review these concepts briefly as additional areas where technical assistance might be helpful.
Thank you, Jennifer. And so we're going to start out with maintenance of effort and talking around basically what this means. And I'm not going to go into great detail with this because every county already completed their maintenance of effort utilizing the MOE workbook that was part of the CFL 20-21-96. And so this slide here basically just talks about what maintenance of effort is and how the calculation was completed. And so when you think of the maintenance of effort, you're basically looking at it's a minimum spending requirement that is met throughout the fiscal year. The county can complete the projections from your maintenance of effort and reserve or hold funds for reimbursement to meet that maintenance of effort by the end of the fiscal year, as you're actually simultaneously claiming for Family First Title IV-E. And so when we're looking at maintenance of effort, it must be met, sorry, as I move backwards, must be met and reported out each year. And so many of you have already received information from CDSS where you had to report out what you utilized for that year, where that maintenance of effort was. The amount of that was based off of the federal fiscal year 2014. And is basically utilized to avoid supplantation and supporting the braiding of funding for a service or a project. When you're looking at your maintenance of effort, you will want to make sure as a county that you have a clear methodology that you're utilizing each year and that you're using a calculation and that methodology throughout that same time period consistently throughout that year as well as every other year. And then you're maintaining that methodology as your evidence for future either audits or information that may be gathered. It's also going to be important to communicate and partner with relevant individuals in your budget offices, with your program managers, across your agencies in relationship to like your behavioral health, your child welfare, your juvenile probation, Department of Early Childhood, First Five, all those different agencies, as well as your community partners, such as community-based organizations that you're working with on supporting prevention, because all of the funding that they are using to support programming will be important for your maintenance of effort, as well as for other components such as payer of last resort. As we look at basically the work that we do around Title IV-E, because Title IV-E is also a federal fund, we also have a non-supplantation requirement. And so when we look at that, this basically here is reflecting the difference between supplantation and supplementing. And so supplanting basically is occurring when you have already supported a service or a project in relationship or an activity with federal funds, or that you were basically wanting to utilize federal funds in replacement of existing funds that you have that have already been supporting that activity. So that's going to be supplanting. It's taking and removing funds because you know that those federal funds are available, or that you're going to replace them with those federal funds. Where supplanting is basically where you are kind of braiding in these federal funds in addition to the existing funding that's already there to enhance the existing funds that are available now for that program or activity. And so it can be used to kind of supplement, to further grow a program, but it can't actually replace any of the funding that's in place for an existing program. And so when we think of Title IV-E, we basically, it's a federal fund, and so it has this non-supplantation requirement, as well as it has a payer of last resort requirement, which I'll go over in a few minutes. And that basically means that we have to utilize other funding that's in place before we actually move forward, and we can't replace existing funding, or we will actually be doing that supplanting. And so when we look at the Title IV-E, it provides additional opportunities to ensure that we're supplementing and not supplanting in relationship to those funds. So here I'm going to go over some different scenarios, and basically start out with this one here and talk about basic what is supplantation or what is supplementing. And so if you'd like to share as we're going through, either in the chat or take yourself off of mute to help me decide which one of these is which one. So this first one is the county already is providing parents as teachers as an evidence-based practice via contract through a community-based organization. And this contract is basically supported through $100,000 using the Office of Child Abuse Prevention, or OCAP funds, which consist of these different funds, including CAPIT and CBCAP funding. Title IV-E is now available for claiming opportunities. And so we're proposing that you use 50% Title IV-E funding and 50% OCAP funding as the match. So would that be supplanting or supplementing? Okay, so we have Janet saying supplanting, Patty saying supplanting. Okay, so everybody's agreeing it's supplanting. So that is correct. We can't utilize Title IV-E as a match for other federal or state funding. And we can't change the funding source to Title IV-E because we already were using other funding to support that in that relationship. So then we have our next scenario. And so this scenario is the county already is providing parents as teacher via that same contract with that community-based organization, again, for the $100,000 using those OCAP funds. But now we have Title IV is available for claiming. This is basically what we're finding is that we have a consistent wait list and referrals are coming in. And so that we're now proposing that we actually expand our parents as teachers opportunities and add in additional slots. And so in this situation, could we use Title IV funding and the state block grant as the 50% match? Okay, so we are saying supplementing, yes, and that is correct. So in this situation, we're actually supplementing because we have an additional need that's going to go past those federal funds. And so that basically is how, Title IV can be used to expand or to braid into those other funds that are already supporting that program. And I think it was Katie that put in the chat. Also on the previous one, that if your existing funds are no longer available, so, say you're providing a program and the fund source that you used to utilize is now no longer available, then Title IV could be utilized in those situations to help support that program, as long as it's an allowable, evidence-based practice or an allowable service in relationship to that. So that is a great point. Thank you.
Brenda, sorry, do you mind if I jump in with a follow-on question to that?
Go ahead, Katie.
I don't know if you know the answer to this, but I don't know the answer to this. One of the things that we're seeing that we're concerned about is that with the shift to Prop 1, a bunch of MHSA funds that were being used for prevention on the behavioral health side are potentially not going to be available because of the limitations in Prop 1. So if something was funded through MHSA but now can't be funded through MHSA, so a child welfare agency, for example, wants to step in and try to use 4E funds for one of the EBPs that is a therapeutic service, does that count as supplanting? Because the overall funding hasn't changed, but the limitations on how the funds can be spent has. Does that make sense? So the behavioral health has the same budget, but they don't actually have the same budget for the program. Have you heard anything about this yet?
Right. So I have actually from our behavioral health individual in the county that I'm supporting. And so basically they're making adjustments in relationship to where those funds are being utilized is what you're describing, Katie, correct?
Yeah, and those adjustments are required. It's not like behavioral health is just choosing to fund one program or over another. They're regulatorily limited in how they can spend the funds now.
Correct. And so what do other people think in relationship to that? Let me involve others in the group.
I think that's a great question, Katie. I think, and that's what the concern I have is that it feels like it's supplementing, but it's actually supplementing because the program shift based on whatever limitation happens, right? With Prop 1. So I'm leaning towards supplementing.
Supplementing, okay.
Versus supplanting, just because the shift in the regulations and so.
Right, so we had a change, kind of like what we described in that other, the last scenario that we just went over.
I agree. The funds are no longer available.
Thanks, Harry. Yeah. And so if the funds are no longer available and, in this situation, Katie, I think the additional support is the fact that there is a regulatory change that can be reflected, then you have your kind of supportive documentation to reflect why now you're utilizing Title IV to help support those evidence-based practices that used to be supported through other funding sources. And so that is an opportunity for, currently for counties with that shift that is being made to consider different ways of supporting some of those evidence-based practices right now. Okay, other questions or comments before we go to the next scenario? Okay. So this one is again that we're still using parents as teachers as that example. We still have that contract through a community-based organization still for that amount of the 100,000 using the OCAP funds. And now we have Title IV is available for claiming We again have that consistent wait list and referrals are coming in, but now we're proposing to expand the program and to fill those available slots that we're going to use Title IV prevention funding as well as OCAP funding for the match. So is that going to be supplantation or is that going to be supplementing?
Leaning on supplementing because you're expanding the services to reduce the wait list.
So we're looking at the expansion of the services, but we also have to look at the type of funding source that we're using for the match. So can we use federal funds to match other federal funds?
Oh, that would be adult then. There's a match.
Yep. So that one we made a little bit more difficult. That's exactly right. So it's looking at that, you know, the two different components of it, looking at the service in itself, how we funded that service, and then can we, you know, braid in additional funding to help support it? But then also for the match requirement, can we meet that through that match area? So great.
Sorry, Brenda, can I ask you one more question on all of these?
Sure.
Because ICF, you work in multiple states, right?
Correct.
Okay. So one of the things we've heard is that in these examples, if a county was paying for something with, say, general funds, that would also, in these examples, that would still count as supplanting, right? But we've also heard that is somewhat related to California taking a pretty narrow view of what qualifies as supplanting, and that other states are a little more flexible on if it's coming from a county general fund source, you have more flexibility to shift it versus a state funding source. Is this something that you've seen in other states?
So Katie, that's a great question. So I would say the question has come up in other states, and the feedback I have provided is if you have always supported and you have a history of supporting with a specific funding source, that you don't want to just adjust it now that you have federal funds coming in. So you can expand it and, you know, basically, you know, add into it, but you can't remove that existing funding source. So if you have changes in it, so like, as you described earlier, like where now we have these changes where behavioral health is now adjusting some of where their funds are going, and so they're not going to be available, then that provides a window of opportunity. Or if you have, say that evidence-based practice has been implemented throughout time, but it's not to model fidelity, like we're not actually meeting the requirements of what is needed for that model fidelity, then that offers an additional opportunity to potentially look at some Title IV funding to build it to the fidelity component, but we still can't replace the funding even if it was those general funds. Okay, Jennifer, anything you would like to add?
Yeah, so Katie, I mean, that's a great question, and it is definitely a question that we've added to the list to request to be put forward to federal partners, just for clarification, right? Because there does seem to be mixed interpretation about whether or not that is supplanting.
Okay, so then we have our pair of last resort that I'm going to move us on to here. And this kind of, all of these align together and are interconnected in relationship to, you know, the Title IV funds. So here we're looking at basically two areas of what it means and how do we make sure that we're complying. And so what it really means is that if we have another available funding source that will actually cover that cost for the service, that we need to utilize that other funding source. And that other funding source has to be considered if it was paid from a public or a private source in relationship to that. And so for an example, and I think, you know, Katie's example that we even shared earlier is that, you know, if you have behavioral health funds, if you have Medi-Cal funds, any of those funds that are already providing coverage for that service, then we can't replace it with those prevention funds. 4A could supplement and add into it and be braided into the existing funding streams if you're wanting to expand, but you can't actually replace it. And so in the compliance section, we have the California's Welfare and Institutes Code that reflects that there's a requirement that each county develop written protocol reflecting how to collaborate as agencies within your county on that pair of last resort. I know the state as CDSS is also working on some guidance in relationship to pair of last resort. Initially a draft think it was an ACL or CFL, I'm not sure which one it was now, came through last June, but that has not gone further than that as a draft. And so I think that's still being worked on. But as counties, that may be one area that you can also continue to focus on and move forward with in addressing how, as a county, are we going to address that payer of last resort, knowing the different funding streams that are coming into our county. And so like Jennifer talked about, like kind of revisiting that fiscal asset mapping, or really looking at your fiscal landscape to ensure that you understand fully what's coming into your county and what each of those activities are being funded with, so that you know where that payer of last resort supplementing or supplantation is going to actually be an issue for. And so these are going to be 3 areas that you want to consider in relationship to payer of last resort. You want to make sure that you're thinking of these and how to support your county and where your county could best benefit from them. In each of these areas, you can also receive technical assistance. CFPIC is offering technical assistance to different counties through different technical assistance providers. And each of those can help support you in relationship to looking at that fiscal landscape, really looking at your fiscal asset mapping, or maybe you really were like, we did a basic one and we need to go more in depth. That also can be part of that. And then also supporting around that non-supplantation or payer of last resort areas of getting that work done in your county. And so we talk about the non-supplantation, the maintenance of effort, we talk about payer of last resort, but all of that actually then leads us to basically the braiding and blending of funding. And so I'm going to start us out with this in relationship to talking about what each of these are, starting out with braided funding, and then moving into blending funding. So braided funding basically is looking at 2 or more funding streams that are going to be able to support a single initiative or support a service or the cost of a service in relationship, the total cost of a service in relationship to providing that. These funds basically are coordinated together, but they all maintain their existing identity. So they're mixed together, but you each have your own, reporting requirements, and those identities are maintained. In this situation, you're leveraging both federal funds, state funds, and private funds to be able to support now that service or that integrated goal. It provides more options for sustainability because you're not dependent on one funding source. You can actually then depend on multiple funding sources to meet that service need. And potentially it can reduce resource gaps or gaps in the areas that you are seeing within your communities. It does not require a statutory authority to accomplish, and it can actually be administered in its alignment with the subpart E cost principles of the 2 CFR 200 through -400 for the federal funds. It can allow consistency, in relationship to supporting the services within your community. And sometimes it can eliminate those duplications of services that are being funded through multiple funding streams. But it does require detailed tracking and a strong accounting system to be able to accomplish. Wendy, you have your hand up?
I do. And so I'm trying to understand this concept because we have, with the FFPS, this child parent interact therapy is evidence-based model, right? And then the behavioral health folks uses it and pay out of the Medicare plan, Medi-Cal.
Medi-Cal.
So we're trying to figure out, yes, we could increase capacity or increase, providers, right? But then how, and the reporting requirements separate. So how do we integrate those reporting requirements to kind of blend in that funding? That's the challenge that I'm trying to figure it out. So
right. And so what you'd want to look at is considering actually braided funding compared to blending, because you're not wanting to get rid of any of the requirements or the identity of any of those funding streams. You want to maintain each of them and their requirements. And so when you think of it, it could be through your cost allocation plans. If you have a cost allocation plan that you're assigning to which funding stream, what activity should actually be billed to or claimed to.
Yeah, and the thought is that one family could be in multiple systems, right?
Correct.
And so what's the percentage of a provider or a biller needs to figure out, like, you know, what's the session that goes to Medi-Cal, which session goes to FFPS, and that's where the murkiness happens.
Right. So some of it is looking at each of those activities and which would be covered through like Medi-Cal, which would be covered through those behavioral health funds, you know, the different funding streams already. And then what is left then for that would be covered then through Title IV-E. That will help you develop kind of some of those percentages. You can also do it through time studies in relationship to time studies, random moment sampling, to really get an idea of what activities are allowable for Family First or Title IV-E compared to which are going to be in those unallowable areas, or those work unrelated is what I would call it, that fit into some of those other funding streams. Jennifer, is there anything else you would recommend or suggest?
So what I wanted to clarify with Wendy is, so Wendy, is the thought that you have you have a set of behavioral health funds that currently support so many, for a lack of a better term, slots for PCIT or whatever other practice, and that in the absence of additional behavioral health funding to support an expansion of the program, the consideration is given that the Title IV-E could help support the expansion of that particular program? And how do you track that separately?
Yeah, because essentially, you know, we were discussing how it's easy if the client does not have Medi-Cal, right? So, okay, that client does not tap into Medi-Cal. That's a straight, you know, FFPS billing. But what if you have a client that has multiple, you know, tapping into your Medi-Cal and also, you know, FFPS population that we needed to track? What, you know, how do we split those activities up? So.
Okay. But so still within the same service. So not a concern that the youth or the adult that you're serving is receiving like many other services, but you're speaking specifically about one service, PCIT. So unfortunately, because of those two funding streams and the separate reporting requirements, you do have to have tracking mechanisms in place to separate out those percentages.
Mm-hmm.
And as Brenda suggested, oftentimes what we're turning to is time study to inform allocation basis. And or ultimately, you know, a whole nother complex layer to that is rate setting. I know that behavioral health is definitely moving in the direction of rate setting. And so we're just starting to kind of unravel some of what that, you know, may look like in particular now in the context of the way that behavioral health's moving towards the rate setting for services.
And I think we have Katie's hand up and Cynthia's hand up. So Katie was first, I believe.
Yeah, are there times when there's like a clear benefit to braided versus blended? For example, I'm thinking about like, let's say let's pretend for now that high fidelity wrap had made it onto the well-supported EBP list and was in the plan. Child welfare agencies often directly contract for wrap, but there are benefits to passing the money through behavioral health and having behavioral health pay for wrap because it makes the claiming on the mental health MAW associated with providing wrap services easier. Does it matter? Like when would you want to go with these different strategies to, for example, increase MAW claiming or CMAW claiming, or are there other times when there's a benefit to braided versus blended?
So with federal funding, you typically have to utilize the braided because you can't mix them together. So with blending, you're basically getting rid of all of that integrity of each of the funding streams, and you're putting them all in a pot together, and you lose all of those reporting mechanisms. You lose all those identities for each of them. And each federal fund tends to require certain requirements on reports, you know, how you're reporting it out or how you're maintaining it and how you're meeting the different requirements that's set up for each of those funding streams. And so that's where braiding is going to be typically occurring in this situation, especially when you mix different federal funds with any other type of funding as well. And so in most of our situation, we would say that you're really using braided, because unless you have Congress that is making a very specific opportunity for federal funding, then you have to maintain all the integrity of that federal fund.
Okay, but then conversely, if you're paying for services with, say, like state realignment dollars, general fund dollars, stuff that's like relatively unrestricted and qualifies for CPE, would it then make more sense to do blended because that increases your ability to claim on a match? Like what you're like, I'm sorry, let me rephrase. What I'm understanding is that if you're paying for things with federal sources, you need to go braided because you have to maintain that integrity of the different funding sources and their different reporting requirements.
Right.
If you're funding things not with federal funding, but with, say, general funds, then does it make more sense is the opposite true? That's when it might make more sense to do blended funding, because then one agency can maximize the match capacity for those funds.
If you have the capability of dropping the requirements, the reporting requirements, or the identity for those funding streams, and that's not going to be needed, then yes, you can blend, because then it's all going into one pot and you can report out. What I would say is that there's more often than not now that even some of those other funding streams, such as your general funds, those kind of components, that are starting to add in more reporting requirements and are starting to ask for some of the same level of requirements that your federal funds provide. So you'll probably see less and less opportunities for blending, but in those situations, if they don't have to maintain their integrity and those reporting, then you can blend them and put them all together. Okay, Cynthia. Thank you, Katie.
Hi. So I had a kind of similar question to Wendy in terms of PCIT actually happens to be what we're looking at as well. In one county, we have it where it's being supported with Title IV-E funding, but in another county, it's only Medi-Cal reimbursement. And what we're finding is the Medi-Cal reimbursement is not covering total costs. And we also have like therapists working in another program that's Cal OES funding. So it's like these different funding streams. So when you're saying time allocation, if our staff are providing and billing for direct services, are you saying that then other services such as like facilities and support staff and overhead costs, other things that would typically be in a line item budget, which we do have with Title IV-E, but we no longer have with our Medi-Cal billing reimbursement because of Cal Ames, would you say that that's where you would allocate those fundings? It's supporting like the equipment, the program supplies, it's supporting that one client that you're providing services to, but the direct service billing from the staff member, you're billing that directly to Medi-Cal, but let's say their benefits or whatever else is being billed and charged off to the other funding sources. Is that how one should visualize it in terms of separating out what that funding is contributing to when it's, yes, 25 slots for this one clinician, but the three different funds are covering different components of that total cost? I guess, I don't know if my question's clear, but does that make sense?
Yeah, so I think what you're asking, Cynthia, is can you split out the different activities, the different overhead, the different kind of supportive, like your fringe benefits, those kind of components in relationship to where those costs are being claimed to?
Right. Because I couldn't build direct Medi-Cal billing and then turn around and build direct Medi-Cal billing for that same client to two different sources. I wouldn't split it up, but I might split up the total cost of that clinician, right?
Right. So you could,
Okay.
If that person is allocating across different areas, then yes, you could split out that time across those different areas.
As long as that client, like to Wendy's point, qualifies for all those three different times. But if that's a client that only is Medi-Cal or is only Cal OES, then you would not separate it out.
Correct.
Okay.
You have to make sure that they're eligible. You'd have to make sure they meet all the criteria. And then you'd want to also make sure, like if there's a rate set or if there's a different component, that those pieces that you're splitting out aren't included in the bundle of that rate set.
Okay.
And
all right. Awesome. Thank you.
Jennifer.
Cynthia, what you're talking about, and we talked through a brief PCIT scenario a little bit later in the presentation, but so when you were talking about, so basically about which funding, right, the individual that you're serving qualifies under. So if they qualified as the prevention candidate, then yes, your associated overhead could follow, right? Follow that candidate in the reimbursement structure, unlike the one that would have, if they were only Medi-Cal eligible, then the overhead that would follow that portion of that practitioner's time wouldn't follow. Does that make sense?
Right.
Yeah.
Yeah.
Yes,
Yeah.
you're thinking about it correct.
Okay,
Yes.
thank you.
Yes.
Yep.
Okay, Timothy.
I'm just going to continue this conversation in some ways.
Perfect timing.
So the part that's a little confusing to me there is it's pretty clear that we can't use the FFPSA for the provision of PCIT to a Medi-Cal beneficiary, right, who meets medical necessity, right? Because that should be covered by the mental health plan. Is that fair?
So, well, you actually, they could be dually eligible because we know that there are portions of the activity or the time. Well, I believe that there are portions of activity that you all provide to the client that are not Medi-Cal billable.
So I hear that. But the idea is that it's a fee schedule, so it covers the costs of operation, quote unquote. So I think it would be difficult to submit a billing for a session of PCIT for a Medi-Cal beneficiary to FFPSA. I think there'd be a lot of hubbub if you did that. My hearing of you talking about the braided funding is that if you could identify costs that you wanted FFPSA to cover that were not for the direct provision of services, but supported PCIT, would that be acceptable? Like the building?
As long as it then gets narrowed down to the population, because remember, we still have a candidacy determination of the youth who qualify for these Title IV-E FFPS services.
So
you still have
all
to
the
get
kids
down to the
qualify, right? I get that. So they would all qualify, but if they have Medi-Cal, help me understand the situation in which you could use FFPSA to fund any portion of PCIT.
Okay, so for instance, and correct me if I'm wrong, the training for your practitioner is not covered by Medi-Cal.
Oh, let's go with that. That sounds reasonable.
So based on that, FFPSA, you are eligible to cover training costs for a practitioner, and it's the 50% match, right? It's 50%
right.
Title IV-E reimbursable with a 50% match. And again, right, this all has Title IV-E funding has to come through a Title IV-E agency. So there's that string, right? You have to have that contractual fiscal relationship with your Title IV-E agency. But conceptually, yes, you could be reimbursed 50% of that practitioner's training time. And I mean, there are other allowable activities, and unfortunately, you do have to start to break it apart to a pretty finite level about what was covered in that Medi-Cal rate and what wasn't, and then looking at what's eligible, and what's not.
But if the local mental health plan has a program that is, say, $1 million a year or 1.2 million per year for PCIT, and there's a waiting list, and we want the other Medi-Cal beneficiaries to get served, we can't use FFPSA money to then serve those other Medi-Cal beneficiaries. We need to convince the local mental health plan to increase their contracts or increase their funding for that, correct?
So, Brenda, I know that we've encountered this previously, right? Where the local mental health available funding
Is maximized.
couldn't be expanded, right? So we do have jurisdictions where that's been the barrier. No more mental health funding to support additional expansion of available services. And in the absence of that FFPS funding, we have interpreted can then support the expansion of those services.
Correct. And I think in those situations, what you have to be
I
careful
want you to
of.
say that again real loudly.
And so this is
real loudly
also,
and for the recording. In a situation where the funding for PCIT has been maximized for the mental health plan, FFPSA is permissible to be used, funding is permissible to be used to provide additional PCIT services over and above that funding amount.
We have battled this around, and
That is our understanding.
that is where
Well,
we
I
fall
like that answer.
on the interpretation.
So
And I think that is supported through like that pair of last resort document that CDSS did issue as a draft. It references that they are not going to require that all providers that could be Medi-Cal eligible become Medi-Cal eligible. And so that means that there are opportunities in relationship to if there are not equivalent funds or funds to support it, that you have to have other funding streams, which Title IV could then fund in those situations. Okay, Wendy or Timothy, anything before we move on to Wendy?
I guess the only other part that I'd say is that's sounding as if we were to have two separate providers, one that's contracted with the behavioral health plan and one that is not.
Correct.
Right.
And so
okay.
the issue that you may run into is if you have, say you have rate setting on both sides and one provider is getting a higher rate than another provider, then where is the incentive, for, which opportunity has a better incentive? And so then you run into dilemmas in that situation. This is another area that we have been trying to seek additional guidance as well on, to try to get that clarification, because when you truly read what payer of last resort says, when you read the different requirements in relationship to it, Title IV has to be considered the last of all funding streams. But if there are funding streams that are not available because of they're maximized or those different situations, then what does that mean? Or if states such as California makes the determination that in their Medi-Cal plan or their behavioral health plan that they're not going to cover certain services, then can those be then covered through Title IV? So those are the basically areas that we are still trying to seek clarification. But that is our understanding at this point in time.
Thank you. This has been very helpful.
Thank you. Wendy.
yeah, I kind of want to add on to another layer of that,
Okay.
because if we really wanted to separate out the Medi-Cal eligible kiddos and FSP kiddos, I mean, don't we want to track everyone and like not so much track, but like really want to provide the support for all kiddos? So if a kiddo that has Medi-Cal and also is in the eligible for FFPS, even though that clinician is Medi-Cal billable, don't we want to have some time for that clinician to be able to track FFPS data and the cares? That's just my thought on that.
So you're saying to split out and allocate some of their time in relationship to the work that they're doing also on FFPSA if they're entering and documenting?
Yeah, I think, the FFPS can support that administrative cost in terms
Correct.
of time.
Correct. So that would be a non-child specific administrative cost.
Right.
That if you were doing a time study to or random moment sampling, a methodology that actually will capture that individual's time, you would know the percentage or the opportunity that you'd be able to then claim to.
Right. So it could be training the current existing Medi-Cal PCIC provider to learn how to input that data into cares and still tap into the FFPS funding to do that work. Thank you. This is very
Okay, thank you. Okay, so I'm going to move us past this. I know that we still have some questions in chat and we'll get to those as we continue to move. But this is kind of just what we already have talked about with the blended of funding. So I'm going to move us past this and really kind of highlight these 4 areas that when you think of braiding and blending, and I think we also highlighted this earlier, is it offers some flexibility. It provides that opportunity for sustainability. It also gives us that efficiency so that we are not duplicating and using multiple funding streams outside of supporting an evidence-based practice or a service. We're now kind of connecting them in together to provide those supports, and it can provide those improved outcomes. So I'm going to turn this over to Jennifer, and we're going to kind of continue in this thought process of bringing it together. and really kind of giving you some more opportunities to kind of have some of the same discussions that we've been having. Jennifer.
Brenda, before I do that, can we do a time check? And then,
Yes. So we have 15 minutes left.
oh, we do.
Or sorry, I
Actually-
think 20 minutes. I think we are 10 after, so 25
No,
minutes
actually,
left.
I'm so sorry. You actually have 5 minutes as to 1:50, and then the
Oh.
closing is at 1:50 to go back to the main session.
Okay, well, thank you for that, Gigi.
Sorry.
So Jennifer,
Sorry.
we're gonna do this part quick.
Well, that's what I thought. Thank you all. You all have brought such a great discussion today. And I actually believe, Brenda, a lot of the information that we covered and have had in discussion with you all really was a lot of the latter part of our conversation. And I actually think, Brenda, let's leave it here. And I want to revisit a couple of there's a couple other questions that we might want to highlight that were throughout the chat.
That's what I was trying to get to here.
And
please feel free to reach out to us through our emails. I can put those in chat as well real quickly, as well as we do have a toolkit that we provide in the jurisdictions that we're working in that helps supports around some of these areas. But also, if you have a technical assistance provider, many of them are supporting in these areas as well. Okay, Jennifer, is there a specific question you want to start with?
Well, so I just wanted to go back. There was an earlier question around the maintenance of effort. Someone made an inquiry about, do we know, is the maintenance of effort, like calculation, is that in perpetuity? And so what I would say is that our understanding is that that's a one-time calculation based on that federal fiscal year 2014. And we are not aware of a future dated recalculation, but that you do have to meet that maintenance of effort on an annual basis.
Correct.
So hopefully that answers the earlier question.
Okay, in the few minutes that we have left, is there any other questions you want to get to? And so I think we have Eloise has a question here in relationship to the PCIT provider, or in that example, if a provider is not Medi-Cal, that we could actually pay for the providers that are not a Medi-Cal provider. And in those situations, that is an opportunity to look at braiding of Title IV funding in, or to actually support it through Title IV funding as well, depending on how else it's been supported. Okay. Well, we appreciate everybody's time today. We know this was a very short and we had a lot of different topic areas to cover, but feel free to reach out to either Jennifer or I. Continue to look at the slide deck for further information and supports. And we appreciate each of you being here today. Thank you.
Thank you, everyone.